Hi everybody. Yes, we celebrated Children's Day some days ago, and you know, even as we celebrate our children, it is important that we keep them safe around our medicines. So that is what today's video is about. This video is for parents, this video is for caregivers, for guardians, anyone in charge of a child. These medication safety tips are very, very important. So you know, accidental medicine poisoning is one of the, leading causes of emergency visits for children in the hospitals. And, it comes from children accidentally taking medicines that they're not supposed to take, either in large quantities or in very, very harmful quantities. So it is important that you store your medicines properly. So today I'm going to be starting with common mistakes we make as parents. Number one, don't leave medicines lying around, as in within the reach of your child, whether it's on a table they can reach, whether it's on a kitchen counter or in cabinets that are not locked. Don't leave them lying around. Children are very curious. They are naturally curious. They want to touch everything. Talking about this now, I'm remembering my own child and how I try to get him to leave things while he's eating. He just wants to touch things on the table. So don't leave your medicines lying on the table so that your children do not, you know, accidentally take them. Secondly, I know that we try to get our children to take medicines and we are telling them, oh, this is sweet, this is candy. Don't do that. That's a big mistake, because when you are not available to protect them from touching, they'll start thinking it is sweet, it is candy, and they can end up ingesting much more than they are supposed to. Thirdly, don't share medicines between children, even if their symptoms are the same. Do not share medicines between your children, even if their symptoms are the same. Another thing is, don't guess the dosage. Someone came to the pharmacy to buy medicines for her children and she was trying to guess. I asked her how old the child is and she said 10. Though, so I went ahead to ask what was the weight of her child and she didn't know. She was just guessing, oh, it's possible she's up to 35. And I told her, no, just bring your child so I can weigh your child, because most of the medications that are produced based on weight. So do not guess the dosage of your child um, when you're administering medicines to them. Even when you're giving them the medicines, right? Don't just use teaspoon. Most of these medicines come with, measuring cups, measuring spoons that you can use so you can give them the appropriate dose. Now that we've talked about the common mistakes, I'm going to be talking about safe practices. How can you protect your children? So the first thing you should do is ensure that your children's medicines are stored in lockers higher than they can reach, cabinets that are locked, so that they do not ingest medicines accidentally. Secondly, especially for syrups, for lotions, keep your medicines closed, as in very tight, so that they cannot open it even when you are not there. Keep them closely, like very, very tight after you have finished using. Don't leave those medicines open. Don't leave it where they can easily reach them. Don't leave it where they can easily open and use. So make sure that those medicines, your lotions, your syrup, are closely tight after you have used them. I already talked about this particular one. Ensure that you're using the proper dosing tools when you're administering the medicines. They always come in your children's medicine, even if they don't come in them. The older ones you've used to wash them and use them could be measuring cups, measuring spoons, measuring syringes that come with your children's medicines. Ensure that you're using the correct dosing. Two is ensure that you know your child's weight from time to time. You can have a weighing scale at home. If you do not have one, visit a pharmacy. Ensure that you know the weight of your child, because most of those medicines come prescribed based on weight, so that you can also give them the right quantity. Lastly, educate your children. It is very, very important, as in age appropriate education, depending on their ages. Let them know how dangerous it is to touch medicines without supervision from their parents. Let them know that they cannot take the medicines on their own. Let them know that they cannot share with other children. The medicine is just for them, and you as a parent, you as the guardian or the caregiver are the ones to give the medicines to them, so they do not end up taking more than what they should. Lastly, you as the parent, you as the caregiver, know what you're giving to your children. Know the name of the medicine, know the dosage, and follow strictly whatever instructions you were given at the pharmacy. However it was written that you give to your child, follow strictly. Know what you're giving to your children. Don't just give anything, so that in case of any accidents or emergencies, you can easily relate to the health professional, so that help will be given immediately to your children. Until I come your way again, my name is Matilda Inibere, and it was a nice video on your screen. If you are not subscribed, please subscribe, like this video, and if you have any challenges with your medicines, kindly comment and I would respond to your comment. Thank you for always engaging. Bye.